Now, why the seminal fluid, which is in a liquid form, does not backflow out of the vagina and come out? The reason for this is because of the presence of an enzyme called as vesiculase. Once the seminal fluid is deposited in the female genital tract, the seminal fluid undergoes slight thickening by formation of a coagulum, which is resulted by the vesiculase enzyme. So this forms a plug in the vagina and prevents the backflow of the seminal fluid. This ensures that the seminal fluid is actually retained within the female genital tract. Now, once the seminal fluid is in the vaginal canal, as I said, it takes anywhere between 45 minutes to 6 days for the spermatozoa to reach the site of fertilization or the ample of the uterine tube. The normal speed of spermatozoa is said to be about 2 to 3 millimeters per minute. As they start swimming through the female genital tract, that is, through the cervix, then through the uterine cavity, and then through the intramural part or body of the uterine tube, majority of these spermatozoa get absorbed or get destroyed. Of millions of spermatozoa that are secreted during ejaculation, only few hundreds reach the site of fertilization. Right? Now, what favors motility of the spermatozoa? Remember, as soon as spermatozoa are deposited in the female genital tract, they acquire motility. And one of the important changes that occur in the female genital tract will result in hypermotility of the spermatozoa. Remember, the spermatozoa has to move against the ciliary beads of the uterine tube. For this, few changes need to occur. So before fertilization, few changes occur in the spermatozoa, right? So what we have done now is, we have both the gametes which are present at the site of fertilization. Now fertilization has to occur. Even before fertilization occurs, there occurs few changes. Now what are these changes? Two important changes that are seen in spermatozoa are, one is the process of capacitation, and the next one is a process called as acrosomal reaction. Now what exactly is capacitation? Remember, this is an important 5-marker or 3-marker for you in your university exam, and MCQs can be asked on the process of capacitation, the site, duration, and what are the changes. What is capacitation? Capacitation is a process of conditioning of spermatozoa which occurs in the female genital tract. The entire process of capacitation occurs for about 7 hours, right? What exactly happens in capacitation? Remember, the head of the spermatozoa is coated with seminal glycoproteins. These glycoproteins are removed during the process of capacitation. How do you identify capacitated sperms? Capacitated sperms become hypermotile. So hypermotility is one of the important signs of capacitation. Without capacitation, it is difficult to achieve fertilization. Now, what biochemical changes will actually help in resulting of the capacitation? Remember, this is because of the increased activity of the adenyl cyclase enzyme. This increased activity of adenyl cyclase enzyme will cause increased rate of tyrosine phosphorylation, which in turn results in calcium influx, and this calcium influx will result in removal of seminal glycoprotein, right? Also, there occurs modification in the cell membrane because of the cholesterol metabolism, right? These are some of the changes that occur during capacitation. So once capacitated, the sperm is now ready to fertilize the oocyte.